There's lots of research now that tells us that young cancer patients have specific and unique needs, healthcare needs and sexual health needs, because of the sort of stages of development that they're going through. And obviously young people are at a different phase in their life. So sometimes they're just exploring what their sexual orientations and gender identities are. So it's a time for them, it's a time of consolidation. And so if they spend a lot of time in hospitals, that can obviously hinder starting relationships and meeting with their friends and doing all the normal things like going out to nightclubs, drinking alcohol, all the things that young people do. Often when people are having treatment, they're unable to do that. So they miss out on a huge kind of social aspect of that time. And sometimes they're having treatment for a number of years. So it's very difficult. Sometimes they're still in full-time education, whether that's college or university, and then they may miss out on all of that education and again the social interaction that happens with peers. Maybe they've got a job, and it's sort of helping them to navigate round, because obviously they won't be as experienced as somebody that's older, and that's been working for a long time. So it's kind of helping them to navigate around, whether it's education, in a new job. As a sort of TYA team, we work with another charity called Young Lives versus Cancer, who help us with, we have social workers that work with us that kind of are experts who advise around things like benefits. Often when young people are in a job, sometimes they'll come to us and say things like, well, I'm not getting any pay because I'm on a 0 hours contract or something like that. And then our social workers are actually expert at looking exactly at what their situation is, and more often than not it does turn out that actually they are entitled to statutory sick pay, and that can be, we can help to support them in sorting out those things that seem quite simple, but obviously, as you know, when you undergo cancer treatment, there's huge costs involved, because not only are they not working, so they're not able to earn, they still have to pay all the bills that they would normally have to pay, and then on top of that, it's all the trips backwards and forwards to hospital that can be quite costly. And I think sometimes, unless you've got experience of the amount of times that these people have to come into hospital, for the general public, I guess there's a lack of understanding, because it's not that they're not just coming for their chemotherapy, they're coming in and out for blood tests, they're coming in and out for clinic appointments, radiology appointments, all of these different appointments. So they're backwards and forwards to hospital quite a lot. So again, as I said, that can have quite a huge cost implication. So it's about helping them out with things like that, advising them what grants and benefits they're entitled to. And then obviously with young people from an emotional sort of point of view, again, because of the stage of life they're going through, they're still kind of discovering who they are as human beings and where they want to go with their life. And body image is obviously a huge factor as well in young people. So hair loss, again, that can be quite significant for both males and females. So it's kind of helping them to, supporting them and helping them to navigate through the whole journey, and hopefully afterwards into recovery and